Hello everyone, I'm Dr. Swagatesh Bastia, Director and Co-founder at Alleviate Pain Management in Bangalore. Today we are going to discuss about frozen shoulder or adhesive capsulitis. Now frozen shoulder, as many of you would have heard about this term, is one of the commonest causes of shoulder pain in the society. Understanding what happens in frozen shoulder, we'll take the help of this model. So this is the shoulder joint here, and these are the structures that make up the shoulder joint. Enclosing this shoulder joint is a loose capsule. What happens in adhesive capsulitis or frozen shoulder is this capsule can get thickened and it tightens over these structures. Now imagine a loose balloon over my shoulder which doesn't restrict any movements. Now if this balloon is pulled and tightened over my shoulder, it will restrict movements. The movements that are mostly restricted are overhead activities, and it impacts daily activities like combing your hair or drying of clothes especially. Sometimes some patients even experience pain at night and it disturbs their sleep. Are diabetes, and it is also seen in hyperthyroid and hypothyroid states. Though diabetes as an association stands out with patients of frozen shoulder or adhesive capsulitis. The other causes that are commonly seen are long periods of immobilization that happen after fractures, surgeries, or in stroke patients. Now, the progression of frozen shoulder or adhesive capsulitis is divided into 3 stages, with each stage lasting for even months. So the starting stage for frozen shoulder is the freezing stage, where there is increasing pain and gradual pain predominance than limitation of movements. Then we get into the frozen stage, where there is less pain, but due to the stiffness and the adhesions, the limitation of movement is pretty extensive, and it causes a lot of difficulty in doing activities. Following these 2 stages comes the thawing stage, where the person starts regaining the movement little by little, and the pain also starts subsiding. Certain conditions which bring about long immobilization of the arm, just like we discussed, like post mastectomy or post surgery or post fractures, should be given proper mobilization exercises following the period of immobilization and strengthening exercises to prevent stiffness in the shoulder and adhesive capsulitis setting in. Traditionally, physical therapy, steroid injections and manipulation under anesthesia have been tried for the treatment of frozen shoulder. But in our practice at Alleviate, we've had absolutely fantastic results with a treatment which we call the triple procedure, which involves Supra Scapular Nerve Block to put the patient at ease. Then what we do is something known as Hydrodilatation, where we fill this capsule up, distend it with a mixture of dextrose and local. Then we bring about manipulation of the arm. So the advantage is the patient does not have to undergo general anesthesia or does not even need to get admitted in the hospital. Now following this triple procedure, for some patients whom we see associated soft tissue damage, we also recommend comprehensive PRP prolotherapy of the shoulder to facilitate healing and rehabilitation. If you or any of your loved ones are suffering with frozen shoulder or adhesive capsulitis, please reach out to us at Alleviate.